to create that system that the VA has and has been shown to work incredibly well for all the rest of us. I'll tell you just a very quick anecdote from my practice in Philadelphia. We have a number of teaching hospitals in Philadelphia that are all within 2 miles of each other. And I happen to do obstetric anesthesia, and many times at night or on the weekends, we have a patient brought to our hospital who's pregnant. So what happens in Philadelphia is if you call 911 for an ambulance because you're in labor and you don't have anybody to drive you to the hospital, the ambulance takes you to the closest hospital that delivers babies. It doesn't matter if it's your hospital. So we get these women who've had perfect prenatal care. They've been to every visit, but they're down 2 miles down at Jefferson, and it's 3 o'clock in the morning. We have to redo everything, every test, every blood count, HIV testing, you name it. We have to do it all. We have to do it all stat, which is the most expensive because we have to make sure that we're doing the right things for this patient. So we are all so committed to getting this health information technology system up and running. That in and of itself is going to decrease costs for that sort of thing. It's going to hopefully limit the number of CAT scans and x-rays that people have to get in their lives, which we know is damaging because of that radiation, because we'll be able to get those results quickly, immediately. So the money's in there. The current argument is about something called interoperability, which means that the systems can actually talk to each other. And so that's really where we're at right now. There's a very smart man, Dr. David Blumenthal, who's in charge of this at the federal level, and he's working to make sure all the systems can talk to each other, and once that happens, I think you'll see pretty quick adoption.
Thank you for a wonderful, wonderful explanation. I'm so glad I came to hear it. I wanted to say at some 30 years ago, I was the chairman of the Committee of 100 for National Health here in Ohio. Mm-hmm. Howard Metzenbaum was president, and Sebastian Lupica and all the unions were involved. Our goal was health security, like social security, was for everyone. And our main goal was to eliminate profit from the healthcare system, from the insurance industry, and from the pharmaceutical industry. Please go over that very important component of cost for me.
Well, this legislation does not eliminate profit. What it does do is it will have the impact, I believe, of decreasing profitability somewhat, certainly for private health insurance companies, mostly because they will now be mandated to spend 80 to 85 cents of every dollar actually on health care. Currently, it ranges from, I've heard on the low end 65 cents to probably the average is around 70, 75 cents of premium dollars are actually spent on health care. So that is going to change their profitability slightly because that money, what they're not using on health care is going, some of it, to profitability or at least bonuses and things like that. And there will be these fees on the pharmaceutical industry and the device industry, but certainly I think in the scheme of things, and those fees were agreed to so readily by those industries that you don't get the sense that that's going to have a huge impact on their bottom line, or I don't think they would have agreed as readily to accepting some of these fees. So that's just where we're at right now. I think the future will depend on how well this current effort does in controlling costs. And if it is inadequate, then you will see, I believe, more talk of things like a public health insurance option that would create competition with private health insurance companies and other measures like that to help control costs.
Dr. Arkoosh, thanks for your sparkling clarity on a very complex subject. I want to ask a political question since we're in one of those halves of American history. It's an election year. And that is, on the one hand, we've got a very complex engineering task, like building a bridge. We want it to work. We want it to be able to carry cars from one bank to the other. And you don't usually have political arguments about building a bridge. But those opposed to this bill appear to have taken hold of emotional sort of taglines like socialism and government takeover and such. There's a woman who's been reported who had cancer, who's rescinded from her policy, who has come out against healthcare reform, actually, even though she was a poster child for it. And so we've got this curious thing where large numbers of people who would clearly benefit from a better bridge that would get them over a very rough patch of water coming out against that bridge. Can you speak to what sort of forces are being aligned to try to repeal or block the implementation, and really whether this is just a very loud sort of scream or whether the Tea Party movement really threatens a rational, engineered solution to a tough problem?
Well, I think that one of the things that I've found most ironic in the entire debate of the last year and a half is that when you look at the members of Congress who have been most actively speaking against this legislation, for the most part, not entirely, but for the most part, they come from states with the highest numbers of uninsured individuals. And I just find that so ironic. And again, I guess I just have to go back to the comments I made earlier that there is a very fundamental philosophical difference in this country about if health care should be made available to everybody or if really we're each on our own to find our own way to get it. And that's what's driving a lot of this. They are deeply held beliefs that are going to be actually very difficult to change, except that when Medicare was created back in the 60s, this same degree of extremely intense, acrimonious debate took place. And now, today, people love Medicare. In fact, many of the protesters in August were screaming, "Keep the government out of my Medicare." So I just have to assume that, people have to work through this. There's been when you're against something, it's so easy to be against something because you just keep saying it's bad, it's bad, it's bad. There's no nuance, there's no subtle anything. You just say it's bad. When you're for something, you have to explain it. So the folks that have been saying this is bad all year have really gotten their message across in a way that people are afraid. They're really worried about this because people have been saying it's bad and they've been saying it loudly. So hopefully, through forums like this, where we can have factual information presented, people can ask their questions and get them answered, people will learn about this bill and they will understand the facts and what it's going to mean for them and their family, and then they'll be able to make a less emotional decision about it. They may still not like it, but hopefully they won't be afraid and fearful that it's going to be a bad thing for them. And I would just point out, remember, all those members of Congress are going to be in this with us. So I think that right there, that's a pretty good safety check. Thank you.
Today at the City Club of Cleveland, we have been listening to a Friday forum featuring Dr. Valerie Arkoosh, President of the National Physicians Alliance. Thank you, Dr. Arkoosh. Thank you, ladies and gentlemen. This forum is now adjourned.
For information on upcoming speakers or for podcasts of the City Club, go to cityclub.org.